At this point, it is important to understand that this paradigm is a new paradigm that applies to our cancer patients with the understanding that now the onus is on us as the cancer doctors to go out and look for those patients and bring them in and let them know of this remarkable treatment options if they're matching to this option. So the energy is on us to find them. The patient would not know that whether they have this cancer gene fusion or hybrid cancer gene causing their cancers or not. And the cancer genes involvement in cancer formation in this case is very interesting and unique. So it's a very rare cancer gene. The NTRK gene fusion is found in only about up to at the most 1% of all cancers in the human. But there have been at least 20 different cancer types: breast cancers, lung cancers, colorectal cancers, head and neck cancers that are common cancer types that can be found to harbor these fusion NTRK gene. But there are some really rare cancers that actually is found to be enriched in this cancer gene. So there are some really rare, like salivary gland cancers, infantile, pediatric infantile fibrosarcoma. There are some of these rare cancer that doesn't occur a lot, but when you find them, when you see the diagnosis, it's almost 80–90% chance that they will have this gene. So we have to now look at cancer treatment, diagnosis, how to discover the cancer gene, molecular character of the cancers, and then matching to the targeted therapy in a whole new different way. It also impacts on our approach of molecular diagnostics, how to look for these mutations. In the past, there is FDA paradigm of companion diagnostic gene mutation testing the gene mutations one at a time, one gene at a time. You take a little piece of the tumor tissues and go for one test. If you want to test for another gene, you have to take little tissues, do another test. And now even the FDA is leading the charge of this new paradigm of rare cancer drug development process, in the sense that we are now advocating for comprehensive, unbiased cancer profiling test. And that will be possible by the new technology of so-called next generation sequencing, which is something that we have adopted.